Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And today we're going to be talking about cost savings in medical care. People are constantly concerned about how much is it costing, both the national discussions but personal pocketbook discussions as well. I know in the counseling business, when people would come in to see me, the question that they would have is, what's it going to cost and is it worth it? And sometimes I once saw a couple for marriage counseling for a year, and they ultimately decided to get a divorce. And at one session, the woman turned to the man and said, you know what, I'm done. I'm going to get a divorce. I'm not going to do this anymore. I'm finished. And she got up and left. And he looked at me for about 30 seconds, and he said, where's the refund window?
Yeah,
because they had been paying, all along. And so, part of the cost calculation is what does it cost?
Right.
But part of the cost calculation is what does it save? Mm-hmm. And so today we're going to talk about cost-expense ratios for people that are aging and going through the cascade of deterioration that starts with the loss of hormones, and particularly women, but men as well. We'll include costs for them, versus the cost of Kathy's treatment, bioidentical pellets at BioBalance Health here in St. Louis, and talk about what they cost and what they save, just in terms of dollars. And then we're going to talk about long-term benefits in terms of long-term care issues as people get older and older, the average cost that exists today versus the savings that can occur if the treatment that you provide is successful.
And continued.
Yeah, so when we talk about cost, if a woman comes to you, she's postmenopausal, and she's complaining of depression, anxiety, weight gain, general malaise, discomfort. Her current doctor doesn't seem to be able to find anything to do. Loss of libido. Her husband's complaining. Her kids are complaining. Everybody's saying, what's wrong with mom? And she's saying, I don't know, but it feels bad. And the doctor's saying, well, you're just getting old. You're just getting old.
You just have to live with it.
You just have to live with that. There's some things we can do. We can put you on an antidepressant. We can put you on an anti-cholesterol. We can put you on an antihypertensive. We can put you on an anti-anxiety. And we'll do the chemistry set ratios, and we'll do the best we can.
Most people who come to me are on like more than 5 drugs because they have not replaced their hormones and they've not gotten back to young, healthy levels and young, healthy body mass. And it makes
Fosamax.
And Fosamax for osteoporosis. Many of these drugs are expensive, even if you're just paying copays, because the copays, by the way, the insurance companies have shifted all the costs to you, by the way. So it doesn't matter, even if you have great insurance.
Right.
They've increased year by year, that little drip of water. You've gotten more and more you have to pay for each prescription. You've gotten more and more, if your deductible is like $5,000, that means everything you do, you have to pay yourself for the first $5,000. So, I mean, if it's a matter of buying or coming to somebody who doesn't take insurance, you can still send it into your insurance for reimbursement. But that $5,000 is going to be yours whether you get good treatment or not.
Right.
And it's expensive.
Speaking of good treatment, it is important to say that what we are not saying is that if you come to Kathy and get these treatments, you will be able to come off of your antidepressant, you will be able to come off of your because there are other factors in people's lives that cause this. We're talking about the physiologically caused issues that can be repaired or restored by bioidentical hormone replacement.
It's over time. We never stop antidepressants right away, but sometimes people, in general, people feel so good, their depression was from loss of hormone, then they can come off antidepressants down the line, maybe after 2 pellet insertions.
So the individuals that come to you and receive treatment report anecdotally that they have been able to come off of these medicines.
Yeah, they come in and they
So you're not saying if you come and get it, boy, that'll wipe this out.
Or you can stop taking your medicines the minute you show up.
Right.
It's a matter of time. It takes a year or so for you to get back to normal, and then we reevaluate. Is your blood pressure down? Is your cholesterol down?
Yeah.
Usually those things get better by replacing the hormones. You kind of go back to 35.
So in a worst case, with all these compounded issues, we've calculated some average costs, average monthly and yearly costs for people that are on hypertensives, antidepressants, anti-cholesterol, sleeping pills, anti-anxiety, and Fosamax, which are, it's a pretty clear cluster that a lot of the people that come to see you
They've
are
gotten
already
these from
on.
multiple doctors too.
Multiple
so
doctors.
They've been to multiple doctors, multiple copays.
And not counting any over the counter stuff that they decide because they've seen the ad, oh, I should try that, it may help.
That's true.
So the average cost per year for that is $3,948 for men or women who are on these things, except that men won't be on the Fosamax. That's a $720 a year subtraction out of that. So $3,200 to $3,900 a year is what they're putting out for these meds.
For just those medications.
Trying to make themselves feel like they have energy and life and the capacity to function.
That still doesn't necessarily work, but pellets, we usually get people off some or all of their medications over the first 2 years.
And those medications block for these issues roughly $3,500 a year that someone is paying. Combination of them and copay or the insurance company or deductible.
And those are average costs that I've accumulated from the internet, and average copays, mostly based on Midwest numbers because everything changes on the coast a little bit, goes up. But those are Midwest costs and Midwest averages for 2012. I mean, it changes all the time. But the first thing patients come in and tell me is, oh, I don't care what this costs, I'm paying it. And they act like that, they're buying a car. It's for a woman, after the initial visit of $250 for a 45-minute or more visit with me.
The initial consult is a flat rate. Okay.
Then the pellets are about $500 3 times a year.
Okay.
So if you're on a maintenance of 3 times a year, which is typical, then women are going to be paying $1,500 a year.
Right.
Now, if they get off some of those medicines, that's going to more than make up that cost.
Right, because those medicines are twice that already. So whatever combination they can come off, and that's not counting the women who present with these issues who've already started taking hormones of one kind or another.
That's right.
That you're going to offset by the hormone replacement that you provide, because those costs average another $100 a month or $1,200 a year.
That's right. So you're replacing one hormone, the pellets, for your hormones that you buy at the pharmacy. So when they're thinking about coming into a doctor's office and spending the money there, they're not really thinking about, oh, this is 4 months worth.
Because it's a one-stop shop.
Right.
It's not like going
so we're
here and
doing
going
the
there.
medicine and we're providing the care at the same time.
Right.
And so that's really a lot less just in the short term immediate savings.
Right.
They're going to save that.
So part of the message here, this is not an additional outlay to monies that you're already spending. It's an outlay that can replace and reduce monies that you're already spending.
Right.
So for the cost, an average cost of, say, a Starbucks a day, if a woman was to go to Starbucks and get a cup of coffee every single day of the year, it costs her about $4 a day. And that's what this would cost, about $4 a day.
Well, you can even replace it. You're going to if you're taking estrogen and progesterone, you're going to be spending $1,200 a year.
Right.
So, I mean, that's the same. The pellets are $1,500, so you really are looking at
just for the coffee. Yeah, exactly.
Less than coffee.
Yeah.
So even if you're just replacing your hormones, we're replacing your cost, your copays, your cost for the hormones that you were paying for at the pharmacy. It's just that it's 4 months at a time.
Well, and so what happens often, you'll have to say if it's typical, but what happens often is that a woman finds you because her friends tell her, she's surfing the web, her doctor is saying this or that, other doctors do refer, especially ones that can't solve like migraine product.
Well, more and more doctors refer to me now.
Yes.
Because now they send me their wives and their sisters and themselves.
Yeah, actually, my physician went to her recently and she was talking about you and that she gets your treatments, and she said, I have to tell you, it's the only reason my teenage kids are still alive. So I don't know what she was on before that she's come off of, but her kids are still alive. And what's that worth? Priceless?
Yeah, a lot, priceless. So we'll talk about those those type of things that you get out of this treatment afterwards. But I mean, just the monetary immediate costs are what people are looking at. And it is, they feel like that's a lot of money. Well, it is a lot of money, but it's a lot of money they're already spending. Right. And we try to save them money in any way we can. I mean, if you have osteoporosis and you're spending $700 a year on Fosamax. Right. And that's
with the side effects.
And that's with insurance because it's the highest copay, but you're improving your bone strength, but very slowly. your bones are going to be back to normal in 2 to 3 years. If you have normal osteopenia or porosis, they come back to normal with estrogen and testosterone much faster than they do with Fosamax without the side effects. So
that's included in the cost of what you do versus an outlay of $100 a month.
Another drug, another doctor,
yeah,
another test, and then you have to go to the radiology department or to your doctor and get their bone density, and there's a copay for that.
Right.
So you're paying that copay. So if you really look through it, you're saving money by doing this immediately.
Saving money and feeling better.
And feeling better, and you don't have to spend your time at the pharmacy. So one of the other things in the immediate savings is that you don't have to go to the pharmacy and wait in line and have to have these other prescriptions filled. That's huge. I mean, I hate standing in the pharmacy and it's never ready when they say it will be, because of course you're supposed to walk around and be bored and buy things.
Right.
So that's a lot of.
It's a marketing strategy.
It is.
Yeah.
It is in many of the drugstores, not all of them. Of course, pharmacists are some of my best friends. So I don't want to make any of them
But
mad.
would you want your daughter to marry one?
Yeah, of course. Yeah, they're great guys. They have better hours.
It's a discussion
than we
from
do.
another
I know.
Yeah.
I know. But one of the other things, we'll talk about men now, because men need a lot more testosterone. So they're.
That's what I was going to say. If you.
Yeah.
Typically, a woman finds you.
Yeah.
And she gets the treatment and she gets better, and then her husband starts to get a little antsy because her libido has come back, and even though he's been complaining for years about her, he may not have recognized that his is declining as well, because it's so easy to put the responsibility for that on the wife.
And if you're not using it, you don't notice it.
Yes, that's what people tell me.
Yeah.
So we did some research and looked on Google, and you can Google it.
And this is his favorite part of this, of course.
The average number of times that people have sex is a question that I am always asking in counseling sessions. You know, what's normal? Is my husband abnormal because he's always thinking about it or talking about it or wants it, whenever? Am I abnormal because, with all the distractions and responsibilities I have, I'm not really interested. So what's the average? The average, according to Google, the website that we checked, for couples living together, not married, average 148 times a year. For couples who are married, average 96 times a year. So the secret is divorce your wife and then just live with her, and your sexual experiences will go up by a third.
Maybe it's because people living together are younger.
Yeah.
It may be that as well.
Right.
But it does, it's just like anything else. You want something, you want that car, you want to possess something.
Right.
You're going after it harder than if you have it.
So
and it's sitting next to you watching TV every night. That's a whole different experience, and I think that has something to do with attraction and the neurochemicals that cause attraction. However,
but where we were taking this conversation is so
that's
the
not
man
where we're
begins
going.
to get concerned, and he also, by comparison, begins to recognize the resurgence of her energy, her alertness, her awareness compared to his own, and she will steer him to you.
Yeah, he wants what she's having.
He wants what she's having. And so he comes in. And so let's talk about the numbers of cost savings for men, because men, if you're a 60-year-old male, 55, 70-year-old male, you also may have all of these issues. And we didn't talk about obesity as an issue,
right,
but the hypertension, the anti-cholesterol, the anti-anxiety, the antidepressant. So if you're taking the same average meds that someone would come in, the same 39.48, then you're looking at male costs, just uniquely male costs. If the man is already starting to try to use androgel or androderm or something like that as a way to restore his libido, that's
your highest copay. That's like $60 a month, and if you're paying for it, it's more.
$720 a year that you're shelling out.
Yeah.
And then if you're taking ED drugs, if you're taking something like Cialis or Viagra to enhance or qualify your performance, those things run $20 a pill, and the insurance limits you to 30 pills in a prescription.
No,
20. Six.
You get 6 pills a month.
6 pills a month, which
so that's the
lowers
average.
Those averages. All the hell.
They must have looked at the averages too.
But at $20 a pill, you're paying, where do we figure that out?
Insurance doesn't usually cover Viagra. I have to say that. Viagra and Cialis and Levitra are usually out-of-pocket expenses.
Yeah.
In general, they won't cover it. So you're talking $20 a pill. So that's expensive. I mean, if you're doing that and you say, what'd you say, 6?
6, yeah.
So 120 a month.
Mm-hmm.
That's $120 a month. That's a lot for having sex 6 times. Actually, I had a patient. I've told this story, but I'll tell it. I haven't told it on camera. I had a patient in Kansas City. We go to Kansas City, and I have an office there, and I take care of women and men there. And when I first got there, there were patients of the doctor that I bought the practice from because he was doing pellets there. And a gentleman and a woman, she's still my patient, came in and said, they sat down very meekly, and the man said, "This is the best deal I've ever heard of." And I said, "Why?" You know, because usually that's not what I hear.
Right.
And he said, "You know what? I guess he said he had figured it out, but he said for $400,
right,
said, my wife and I can have sex every night for 4 months." He said, "But if I go down to Maine and 2nd Street, $400 only buys me an hour." And I went, "How does he know that?"
Yeah.
And if I were her, I would have whacked him.
Yeah.
And she just sat there smiling. So it didn't bother her. But I mean, that's kind of how their math worked. Everybody's math works differently. And the number of times you have sex is going to change, is going to matter if you're taking Viagra or Levitra.
Well, if your relationship is good,
yeah,
and you love your partner and want to have sex with your partner, if your body feels better and is more responsive, obviously that number should increase.
Yes, it should.
You know, and so you get out of performance sex for, checking the box. Yeah, we did that this month, or obligatory. It's our anniversary.
We're trying to wipe that out.
Yeah, exactly. So the combined cost, if you have this couple, the woman came in first, and then the man comes in, and they both get the treatments. The cost for the men of the BioBalance Health treatments is
more. I mean, for the men, they have many more pellets. I mean, their average is 10 pellets. So if we're looking at 10 pellets, and they come in every 6 months. So, and their insertion's a little different. They have 2 insertion sites, and so it's a little more expensive. But after the initial consult, it's $3,800 a year on average.
Okay, so it's about twice as much, a little more than twice as much.
Because it's a lot more pellets, and the charges by the pellets, because what you need.
Although there's a factor, a lot of times men's costs are reimbursed by the insurance, a significant portion
about
of them, where women's are not at all.
About 2/3 of the men have their costs reimbursed by insurance. But the women in this area, in the Midwest, don't get it reimbursed. In fact, I don't think they get them reimbursed anywhere.
The women?
Women don't, because they don't think we need testosterone, of course.
Yeah.
Even though it's going to save them all this money, the insurance company, for all these drugs, and they haven't really put that together yet.
Right.
But any cost shift that they can do, they will.
Yes, absolutely.
So that's just kind of how they operate. It's a business to them. It's not warm and fuzzy. It's just a business. How can they not pay more money? So they don't really realize that if you're on this, that you're going to decrease your cost for all these other drugs, or you're going to go see other doctors less.
Right.
So they haven't really put that together. I'm hoping that someday they will. Because,
well, hopefully they'll watch the show and see that and say,
that's right.
That makes sense.
Yeah, it would be so nice if that would happen.
So we're looking at an average cost per men of $8,500 a year. If they're taking ED drugs and have already started some.
If they're not taking pellets. If they're
not taking pellets.
Right.
And an average cost per women of $4,200 a year. So you're talking about $12,000 a year for a family that they're already paying in different kinds of.
And we're not talking
costs.
about the kids yet. We're just talking about the parents.
Right.
And so we're saving them. We're going down to the $1,500 plus $3,800. Did you do the math on that?
Right, I did. We're saving them $7,500 a year out of money they've already been spending. If they're the reflective, typical example who have these issues and can come off of them. Now, for every individual person, that's going to vary. You may not maximize those savings. You may increase them. You may just
not
get
be on
some
them,
of
but
them.
you may not have to go on them because this
the
brings your
avoidance
lean body mass is improved.
Right.
It's not a weight loss program, but it is a lean body mass program.
Right.
Lose fat, gain muscle. Muscle's so important for us as we age, and it burns calories while we sleep. So if we have the muscle and less fat, we're healthier.
Right.
So being lean, not being skinny, but being lean is the key to being healthy all the way through and staying independent as you go.
So the bottom line of a discussion about cost, we think needs to include costs that can be saved out of expenditures that are already being made by some portion of the system, whether it's insurance companies or individual client payers, compared to the cost of the proactive cost of this treatment.
Right.
So that's what we've been discussing today. I know throwing numbers around and listening to the statistics is sometimes difficult to conceptualize what was the message, and we'll put some slides up to show you these things as the show goes. But basically what we want you to consider is generally the health benefits, quality of life that's available if you receive these treatments, and then secondarily do a cost-benefit analysis. And look at the expenses that you already have for the things that you're already taking and the side effects that those things cause versus the benefit from doing this with Kathy for the cost that it costs for you to go there.
That's right.
And we think the outcome is pretty obvious.
And we're going to go over some of the long-term
savings. We'll do that in the next podcast.
In the next podcast. So we'll go over the long-term savings that you can get by taking pellets, which doesn't even count the short term, which is what we just talked about. But the long-term savings, both in monetarily and in continuing your productivity and independence.
So check Kathy's website or contact us directly if you want. We'll tell you how in just a minute. But check her website for testimonials of people that come in and say, hey, this is what happened in my life. These are real people. They're not paid people to come in and just say this stuff. And think seriously about it. So if they have questions or comments, how do they get in touch with you? They
can reach me at the website at podcast@biobalancehealth.com, or they can go to the website biobalancehealth.com, or they can call my office 314-993-0963.
And you can always reach me at brettnewcomb.com.